So the CHECKMATE 7FL study was a randomized, multi-center, global, placebo-controlled Phase III study which evaluated the benefit of Nivolumab to neoadjuvant chemotherapy in high-risk, estrogen-receptor positive, HER2 negative breast cancer. It was a trial which included patients with ER positive, HER2 negative breast cancer. They had to be primary disease treatment naive. They had to be grade 3 on ductal histology. That was determined by the local pathologist. They had to have ER centrally confirmed. Patients with clinical T1C, T2 had to be node positive, and patients with T3, T4 could have any nodal status. And patients were randomized to receive Nivolumab or placebo with 4 cycles of weekly paclitaxel, followed by 4 cycles of AC, followed by surgery, and then 1 year of Nivolumab or placebo in combination with the adjuvant endocrine therapy. Patients were stratified for PD-L1 status, and that was determined using the SP142 assay. So in the end, the study was originally over 1,000 patients and had co-primary endpoints of PCR and EFS. But unfortunately, abemaciclib was approved in October 2021. And because abemaciclib cannot be combined with Nivolumab, we expected that there'll be a high rate of patient discontinuations in the adjuvant phase. So we modified the trial just to focus solely on PCR and not EFS. And so the trial became open label for EFS and stopped recruiting new patients. So it went from 1,000 patients to about 521. And also we had the Russian-Ukraine conflict, so that resulted in closure of the Russian sites. So in the end, there was around 510 patients in total randomized. So this was the intent to treat population, and then the secondary endpoint was PCR in the PD-L1 positive population. And so the results were that the addition of Nivolumab statistically increased the PCR rate in the overall population. The difference was 10.5%, so it went from around 12% to 22%. So this is the first time we've seen a PCR increase in ER positive disease, so that's exciting. But of most note was in PD-L1 positive patients, the PCR was dramatically increased. So it went from 20% to 44%. So that's an absolute difference of 20%. So that's a huge difference for PD-L1 positive patients. And for PD-L1 negative patients, that difference was around 3%. So the benefit does seem to be in patients with PD-L1 positive tumors. So it's our belief that patients with immune enrichment derive the most benefit from the addition of these agents in this breast cancer subtype. Obviously, we'll be following for event-free survival, so it's important to follow up long term. With regards to side effects, there was no real difference in side effects with the addition of Nivolumab. Side effects were as expected in this population, and people are a bit more familiar now with immunotherapy in the neoadjuvant setting, so this was not different in this study compared to what we already know. So yeah, in conclusion, the study was a positive study. It met its primary endpoint, and we're following up for event-free survival. But I think this suggests a group of patients with ER positive tumors, which is the most common breast cancer subtype, and particularly younger women as well, have a potential here to increase their outcomes, clinical outcomes, with the addition of these immune agents, which is really exciting.